Hey, it's Anthony. I'm a student physical therapist. For all my healthcare professionals out there, aspiring professionals, or just anyone who's interested, today we're going to talk about Parkinson's. A lot of us have heard of Parkinson's, but aren't actually too sure what it is. Parkinson's occurs when dopamine and acetylcholine producing cells in the brain die off. Now, the big hitter here is dopamine. So, dopamine is a neurotransmitter produced by the substantia nigra, which is a part of the brain located in the basal ganglia. So, dopamine is very big in movement. It either allows movements to progress or stops movements from happening. And in the everyday person, it's regulated pretty efficiently. But in those individuals with Parkinson's, it isn't really a factor anymore. And when those two neurotransmitters, acetylcholine and dopamine, remember, dopamine's the big hitter, happen to die off, individuals tend to have problem with movement. And typically what you'll see is postural problems, you'll see slowness, and in the same sense, you'll see sort of a shaking or a tremor. We often define this as a pill rolling tremor. Essentially what it looks like is when your index finger and your thumb, somebody would be holding a pill between and they're rolling it around. That's why they call it a pill rolling tremor. I'm going to show you traditionally what the stance of a person with Parkinson's looks like. So traditionally the stance of someone with Parkinson's, I'm just going to stand up right here. Their shoulders are rounded, their head's protruded forward, they're very stiff. They'll have slightly bent elbows, slightly bent wrists. At the same time, their knees are going to be slightly bent as well. So in a position like this, often they develop either back or neck pain, and that's due to rigidity. Now, don't forget a pill rolling tremor, usually occurring unilaterally. So on one side, but it progresses bilaterally as the disease progresses, because keep in mind, it is a neurodegenerative disorder. Now, when these individuals go to walk, we often describe it as a festinating gait. Initially, they have trouble initiating movement. So it'll look like they're frozen, and then when they do get moving, it'll be short, choppy steps. So in the therapy world, which is where I come to play as a physical therapist, we want to try to get these individuals to lift their legs up high, to initiate a longer or a higher step length and stride, because they'll come into barriers in their everyday life where they're going to experience high pile carpet, which is in the normal home, transition from tile to a low rise carpet, and that's when falls and tripping occur, and they're already going through all these cognitive and physiological changes. The last thing we want is them to get an injury or experience a fracture, anything of that nature on top of it. So you may be wondering, what's the lifespan of an individual who's diagnosed with Parkinson's? It's been a lot better in recent years. It used to be 10 to 20 years after diagnosis, the inevitable would happen. But as of recently, they live almost just as long as individuals who aren't diagnosed with Parkinson's. A lot of that is contributed to current medications that Parkinson's patients take, one of which, and actually the biggest one, is carbidopa-levodopa. And that's actually two medications combined into one. We have carbidopa and levodopa. Now, carbidopa cannot pass the blood-brain barrier, but what it does do is it carries levodopa through the central nervous system to the brain, along the way preventing it from being broken down. Now, levodopa can pass the blood-brain barrier, and when it passes it, it's actually converted to dopamine. And what that does is essentially it controls movements, or it necessarily slows down tremors. It doesn't prevent them in whole. It'll also speed up movement, so there isn't that slowness. It'll ease off rigidity. So it's a big hitter for Parkinson's patients. You also may be wondering, who are some famous people who have had Parkinson's? Well, we have some currently and then some recently who have passed. And the reason they passed was more so due to older age in addition to the progression of the disease. Not necessarily it took them out at a young age. So we have Michael J. Fox, who's huge. He has his own foundation for Parkinson's as well. We have Ozzy Osbourne. We have Muhammad Ali. And we have Billy Graham. So I'm going to touch base now on what physical therapists do for patients with Parkinson's. And there's kind of three big factors here. One is we want to control their postural instability. So like I said, they tend to have rounded shoulders, forward head, flexed arms, flexed wrists, flexed knees. So typically we'll incorporate exercises such as cervical retractions. We'll do scapular retractions. We'll loosen up their lumbar region. And then we'll just get them standing upright to fight gravity while they're performing those exercises. Number two, we just want to decrease tone, especially for rigidity. So we'll incorporate a lot of stretching, soft tissue techniques, maybe even some joint moves. Number three, there's great exercises called big and loud exercises. And typically you'll do them with the patients. You'll have them move up, out to the side, hands together, down, a lot of movements like that. And that's to get them moving largely, quickly, and more efficiently. Because keep in mind, they're moving slower, they're tight, and they're moving short and choppy. So those are the big hitters with what physical therapy does for Parkinson's patients. I really hope you guys enjoy the content. I'm going by the YouTube channel, The Motion Specialist. I'm just finishing up my first year in my doctorate of physical therapy, and I'm here to put out any kind of health-related, anatomy, fitness, just overall science-based content to help you, the viewer, understand it better and to help me just give back. So if there's anything you want to see, please comment down below and like and subscribe for more. Thank you guys.